Hello and welcome to Self Health Podcast, where I put the health back in healthcare and you in the center. I'm Erix Zimmerman, Registered Dietitian Nutritionist and the Connected Dietitian. I am so pleased to welcome you to episode Self Health 101, the first episode where we discuss the self health movement. No one else has named it yet, so I am. Self Health by Erix Zimmerman, the Connected Dietitian. Pass it on. All information given here are my own professional opinions and thoughts. None of the information or education presented is ever to be taken as medical or mental health advice. And that's exactly what this show is about. If you haven't noticed, we're hitting a major crossroads in healthcare, at least where I live, which is the United States of America. Most people aptly call it sick care at this time because the system has been set up really well to respond to illness, keep people alive as well as possible after a disease has not only occurred, but been able to be identified and a standard of procedure created for treatment. What this means is you have to be sick before we'll really do anything about it for you. And that's the point. We're not looking for a cure, we're looking for lifelong band-aids. I became a registered dietitian nutritionist after my own almost 3 decades of illness and being basically ignored by the medical establishment of doctors who, despite often being very kind and truly intelligent people, couldn't find anything wrong with me. So they labeled me with IBS and mental health issues and passed me on to someone else. I want to be really clear. I don't blame those doctors for missing celiac disease for nearly 3 decades of my life. My limited understanding of allopathic MD medical school is that they were trained that if it waddles and quacks, it's a duck, but if it waddles and moos, it's having a crisis of self-realization and needs to see the quacker to get its head back on straight. It was only after my own struggles and repeated attempts to get medical answers that I returned to college and I got a master's in nutrition to become a dietitian. You see, I had undiagnosed celiac disease, and the healthiest food in the world, wheat, was killing me. Literally. I got so sick I couldn't work. I was ill all the time. I couldn't do basic daily functions, and life was really hard. Thank goodness for the trainer at my gym, which, as an aside, it's because I was still pushing my body to exercise, though I was woefully awful at it, and it was really hard to do. But the trainer said, I'm allergic to wheat, and what you're going through sounds like what I go through. That sent me on a 9-month quest, which led to a new life, finding gluten-free food, and eventually returning to school, as I previously mentioned. So now fast forward 19 years, and having worked in the allopathic medical system as a whole body system, plant-based and nature-focused dietitian trying to support patients for the last 10 years, I've been amazed at watching the unraveling of our wellness system. Part of the reason I became a dietitian was because the focus is on helping people improve their health and wellness before they get really sick, not just after. And that's what I want to focus on. I wanted to help people identify celiac disease and things like it before they got to the point where they couldn't work, before they got to the point they couldn't attend school, before they got to the point that they lost their apartment because their body was fighting such an terrible internal war that they were unable to maintain earning a paycheck and couldn't afford the cost of living. What I found was that most of the time, I ended up chasing the bird instead of getting in front of it. As I have had some major shifts in my personal life recently that caused me to not be able to continue to work a regular routine, I recently opened my own practice called Heart Spirit Nutrition. And in doing this, it's come to my attention that not only do I want to focus on helping people get the health that they deserve so that they don't get sick, but there is also a major unnamed industry that is occurring right now to fill the space of our declining healthcare system. I am naming this space the self-health movement or the self-health revolution. I'm not sure which sounds better, to be honest. So leave me a comment if you love one or the other. Let me know what you think. The point of this is that I foresee over the next 10 to 20 years, it's going to be critical for individuals to be able to have a basic understanding of medical knowledge for their own well-being so they can be empowered to walk into their medical visits and work side by side with their medically trained medical team of experts in their own individual areas. And that person will be able to have constructive conversations, offer their insights because it's their body they live in. They know it. They're there every single day, rather than the 45, maybe 60 minutes at best a doctor gets with you a couple times a year. This puts you as the individual as the center of your healthcare team, not your PCP, not any other medical provider. So this brings us back to that caveat that comes before anytime you ever watch a video documentary on health, or listen to a podcast on wellness and living, or read a book on health or nutrition or exercise. There's always some sort of disclaimer that says none of this can be taken as medical advice. But these intentions of all of these are that people are producing medical advice. They might be sincere in saying they want you to go and check on this with your doctor first, or it might be a way for them to cover up liability and they don't really expect you to. I don't know. And I'm not going to argue on that. But I want to be completely clear and transparent here that any and all information that I offer, I feel it's critical, and I intend for you to go talk with your doctor about it. I want you to take up that 7 minutes you have with your primary care doctor, being able to talk about what you know about your own health and wellness, what you want for your wellness goals, and how you've been educating yourself to be able to be a constructive part of this conversation for your health. It is absolutely critical to me that people do not take this information and just act on it on their own. So I'm about to tell you a story. And every person or story mentioned, unless it's mine or directly attributed to an individual, is always going to be an amalgamation person who's made up from several different people I've worked with, or where personal details like jobs and age have been changed to avoid any personally identifiable information. Now, when I did my internship in the hospital, as everyone has to do before they become eligible to sit for the test to become a registered dietitian nutritionist in the United States, I met someone who had hated vegetables their whole life, and they wanted to get healthy. So they decided they'd start by following this program that a person had put out, where they blended up a bunch of vegetables in the blender and then drank it a lot for many days. As an aside, for your information, fruit and vegetables have the same amount of fiber when it's blended as when you're chewing it from a whole fruit or vegetable. The fiber level stays the same. In the intestines, which are muscles, fiber works like weight training. So just like you wouldn't go into the gym not having exercised in 5 years and start lifting the 50-pound barbell, you don't jump from not eating any fruits or vegetables to suddenly eating 10 servings a day. At best, this is going to give you some gastrointestinal upset. At worst, it can cause some serious outcomes, such as for this person who had a history of abdominal injury, and so they had a place where that much fiber couldn't fit through all at once. And because of this, they didn't know that the fiber could build up, and they ended up being hospitalized with a blockage. This is really, really rare. It doesn't come up a lot, which is why people may not warn you of it. But this is the kind of story that breaks my heart, because this person was doing something they intended to be really healthy. And most people would say it's a great step for health. In general, we want people to have more fiber, but we have to increase it slowly. And this is where working with someone like a doctor or registered dietitian nutritionist who knows your full medical history can give you accurate guidance on how and where to institute advice like this. When you're getting it straight from a book or a podcast and you just jump into the deep end of the pool, you may find out you don't have the ability to swim in that kind of water. And I don't want that to happen to anyone, ever. So please, with my show and any of the information you get off of my website or from heartspiritnutrition.com or through the connecteddietitian.com, as well as anyone else's information in nutrition education, please work with your knowledgeable healthcare practitioners to help you institute it in a way that we can make the best guess will be right for your body. We can guess wrong, but we can help reduce some of those major risks. Now, the next thing that people say is that their doctor doesn't have time for them. or they don't have coverage to see their doctor more regularly, or they don't feel like their doctor listens to them. These are really valid concerns. You deserve to have a doctor and medical staff who you feel like are on your side. Unfortunately, what I've seen is that these highly trained, really incredibly intelligent medical practitioners are often being pushed more often by higher up and insurance companies to turn profit and get people moved through the system rather than care for the people that they want to care for. And to be honest, from my discussions with them, this is not what they went to medical school for. Most of the medical practitioners that I have talked with are really unhappy with the system, but don't have a good answer for how to make the system work better for all of us. I am hoping with this revolution with self-health will be part of what makes a better place for doctors to work and other medical practitioners. These people are incredibly intelligent and compassionate. They spend decades gaining knowledge and information to help individuals live and improve their lives and living conditions and improve living with chronic disease. So important to have at this point. But if you don't jive with someone, that's fine. Move on, find someone else. Finally, the last thing that I want to say around this is that I hear people say they don't feel like they have the money to spend on a dietitian or a certified nutritionist because their insurance should cover it. And since their insurance doesn't cover it, or they don't have any more visits, they won't go. But they'll spend 3 times as much on a life coach, or they'll spend 3 times as much on a business coach, or they'll spend 3 times as much on a health coach or a certified personal trainer. All of these people are incredibly valuable and important, and they have really important places. But if you don't have health working for you, and if you don't have wellness on your side, you will never get your return on investment that you deserve. Put the money, in my opinion, put the money where it needs to be, which is in your health and wellness first with a credentialed practitioner like a dietitian or a naturopath or a certified nutritionist, or even seeing your primary care provider more frequently than insurance wants to cover. Once that's going and your health is on the way, then invest in the coaches so that you can not only live the life you deserve, but also the life you love. Now, if this episode soothed your soul, sparked your syntaxes, or spoke to your spirit, then subscribe to this podcast on your favorite recording platform. I'm Erix Zimmerman, Registered Dietitian Nutritionist and the Connected Dietitian. Thank you for listening to this first self-health podcast where I put the health back in healthcare and you in the center. Remember to never underestimate the power of health and continue to accumulate your self-health wealth. Now, please take care of you. I mean it.